and please use the chat function if you wish as well. We've got a Q&A session at the end, but if you want to use it for any networking purposes, please feel free. All right, we'll just give it another few minutes for the people to join. We'll make a start 12. Right, I think we can make a start. The numbers are increasing nicely, which is great. So very warm welcome to everybody on the call today. Thank you for taking time to join us today for the webinar. It is being recorded, so it will be uploaded to the GM Cancer Academy website following this, so it's available as a resource for whenever you may need it following then. Or if there's any colleagues that haven't managed to come today, please feel free to send on that recording afterwards as well. So thank you for joining us. We've got a webinar today, a range of different speakers from different professional groups around delivering high quality cancer care within the primary care setting and how you can do that through cancer care reviews. So a bit of housekeeping, because it is being recorded, if everyone could stay on mute, that would be really helpful. There is a Q&A session at the end, so any questions that you think of as we go through the webinar, please feel free to put those in the chat, and then we can have a Q&A session at the end. Please also feel free to use the chat for networking purposes as well. If there's anybody that you might want to reach out to or know a bit more about, that would be fine to use. And there will be a feedback survey that is sent out after the webinar, and a CPD certificate will then be sent out following completion. So I think we are ready to make a start. I'm going to pass over to Heather to introduce the session for us. Over to you, Heather. Thanks very much.
Thanks, Jess. So if we could just have our first slide. Great, thanks very much. I'm Heather. I'm a GP in Tameside, and I've also been working with the Cancer Alliance Personalised Care team for the last year, working on a cancer care review quality improvement programme project, and we've been looking at trying to make these reviews really, really worthwhile for both clinicians and patients, so we can get more from them, and that patients will be able to live well with cancer and beyond their cancer diagnosis. And we've come to realise that, you know, the cancer care review doesn't need to be done by just GPs. There's so many people within the primary care workforce who are really well placed to offer this holistic assessment. So we've got a huge representation of many different people from primary care on this webinar, which is really encouraging to see, and I hope you can all get a little bit from this, and be encouraged to maybe go out and try and do some of cancer care reviews yourself. So why is this important? So if we just go to the next slide. As you can see from this infographic, until by 2030, it's thought that about over 2.5 million people will be living more than 5 years beyond their cancer diagnosis. So although more and more people are being diagnosed with cancer, more and more people are living longer with cancer as well, which is great news. But what we find is that about 1 in 4, and I think probably more than this, are actually dealing with long-term effects of their cancer treatment and their cancer diagnosis, and are being discharged from their secondary care cancer specialists into primary care. So in primary care, we've got a really privileged position to be able to support these patients much later on in their cancer journey to live well beyond their cancer diagnosis. So next slide, please. Another infographic showing similar things. So again, an exponential increase if you look at the numbers in the circles of people living with cancer. So by 2030, it's that about 4 million people will be living with cancer. And the text boxes along the bottom, or the speech bubbles along the bottom, are actually really encouraging statistics. In 1970, only about people lived about 1 year after their cancer diagnosis on average, whereas in 2010 it was around 10 years on average. So again, people are living much longer. Obviously by 2030 we'd expect that again to have increased more, and that's thankfully due to better diagnosis and also improvement in treatments as well. Next slide, please. So hopefully today we hope to educate about the process of the cancer care review. We want to improve your confidence to want to upskill and undertake these cancer care reviews yourself, or at least start that conversation in what a good holistic cancer care review looks like. So we've got a number of speakers, and we're going to look a bit of a broad kind of overview. It's been quite challenging to fit it all into a 2-hour block, but hopefully you'll be able to look back at some of these materials and be able to kind of expand the knowledge further. So we're going to think about what cancer is initially. Again, like I said, everyone on this call from different backgrounds, so we're just going to do a bit of a basic overview of cancer and some of the treatments that are available. We've got Charlotte coming to speak to us about the physical impact of cancer. So some of the things that patients might be bringing along to the cancer care reviews to talk about. We've got David talking about the psychosocial impact of cancer. And then Miranda's going to touch on some of the materials that we've produced at the Cancer Alliance, which will hopefully help everybody to undertake these cancer care reviews and know a bit more about the process of the review itself. And then finally, we're going to think about the review process itself. We're going to talk through the new template that we've developed, and then hear from a few patient quotes and why these cancer care reviews make a difference to patients. And also from a practice nurse point of view, why our practice nurse, particularly our practice, has been really encouraged by the cancer care reviews that she's done herself. So as Jessica said, there's some question and answer session at the end. And I guess we'll just start with the first session. Perfect. So I've already introduced myself, so I don't need to do that again. So we're going to just do a little bit of an overview of what cancer is. This will probably be knowledge to most of you, but it's just really good to get a basic background of cancer. So cancer can be benign or malignant. And it's these malignant cancers that are really the ones that have the potential to spread beyond the tissue that they develop in and around the body. So we call those metastases. Cancer is the overgrowth of abnormal cells, and it's these abnormal cells that have that potential to spread around the body. If you go to the next slide, if possible. Cancers are different. There's many different types of cancers, but broadly they can be classified into these different classifications. So most cancers are carcinomas. This is cancer of epithelial cells and includes cancers of things like lung cancer, prostate cancer, breast cancer, and all the more kind of common solid tumor types. Second most common, and this surprised me actually, is actually lymphomas, and that's abnormal white blood cells in the lymphatic system. Other kind of blood-related cancers are leukemias and myelomas. Again, that just summarises kind of their percentages on here. Central nervous system tumours, those are the brain and the spinal cord. And then finally, sarcomas, which are connective tissue tumours, and they affect things like the bone and the cartilage and muscle. And this is just a representation of maybe the more common cancers that we'll see of those of the carcinoma group. If you go to the next slide. So almost 1 in 2 people will be diagnosed with some form of cancer in their life. And I think most people on this call will have either known someone who's had cancer or been affected with cancer or personally been affected with cancer. And therefore it's really important to, it just shows how important it is really to be supporting these patients and their carers beyond their cancer diagnosis. Cancer Research UK, which is slightly out of date now, it's quite old, but just shows that, for example, the 4 most common types of cancer in the UK being breast, prostate, lung and bowel. Obviously prostate is predominant, it is only in males. Breast cancer predominantly females, but important to remember that it does affect some males as well. And then you've got the other different types of cancer as you go down that graph. There's about 385,000 new cases every year. So that will be quite a large proportion of our patients within the primary care setting. Next slide, please. So when we're undertaking the cancer care review, it's important to think about some of the risk factors for cancer and why cancers may develop, because even beyond the cancer diagnosis, we've still got that opportunity to educate patients about risk factors for other types of cancers, but also to improve their prognosis and their recovery from their treatment by for example, stopping smoking. So I think I like to think about risk factors in 2 different ways. So first of all, the general risk factors, those that we don't have any control over really, in terms of things like increasing age. And we know that as we get older, we are more likely to develop a cancer, and also family history. So there are some inherited genes that can or genetic changes that can increase the risk of getting cancer. Many of you might have heard of BRCA, which increases the risk of breast cancer, endometrial cancer. Angelina Jolie made that one famous, but these only account for about 5 to 10% of cancers. So the rest are predominantly impacted by those external factors, of which we do have more control over. So you can see a list of the external factors there. So smoking, obviously, huge impact on things like lung cancer, alcohol and obesity, and importantly, really, lack of activity is a separate and independent risk factor for cancer. It's not just the link to obesity that has an impact over. UV exposure, obviously, for skin cancers, poor diet, viral infections impacted in things like cervical cancer and tongue and oral cancers, and occupational causes as well. So thinking about kind of if there's been any exposure to asbestos or other kind of fumes and things in the environment can be quite important, really, in terms of cancer diagnosis. Next slide, please. So you may well have already come across the staging and grading system. There are a few cancers that use a slightly different staging system and grading system, such as prostate cancer, which tends to use the Gleason system. But broadly, most cancers use the TNM staging system. And this stands for tumour nodes and metastases. So T is for tumour, and that's either stage 1, 2, 3, or 4. And that is according to how big the cancer is and how far it's spread into nearby tissue. So those that are stage 4 are much larger, and there's a big push in the UK to try and diagnose more cancers at stage 1 and 2, because obviously if we diagnose cancers earlier, then the prognosis is better. N is the number of nodes or the place of these nodes that are affected. So nodes is where the lymphatic system is. And if there's no nodes affected, that's N0, obviously better prognosis if it's not spread to the lymph system. And N3 is when the nodes affected are all around the body or beyond kind of the diaphragm, so different locations around the body. And then metastases is M, and that's either present or absent, so 0 or 1. Then the grading is actually how the cells look under the microscope. So how abnormal are these cells compared to the cells that they kind of originated from? So grade 1, they actually look quite like the cells that they came from, and these tend to be more slow growing. And then up to grade 3. So the grade 3 ones look very abnormal under the microscope. They don't look like the cells they originated from. And these are the ones that are more aggressive and grow quickly and have the potential to metastasize much more quickly as well. Next slide, please. So it's impossible to touch on all of the treatments that are available for cancer, and certainly I'm no expert in that either. And you don't need to be to undertake a cancer care review by all means, but it's sometimes useful to have a brief overview of some of the treatments that are available, just so that you can understand some of the potential side effects or long-term effects that patients might be undergoing and be able to offer them some advice. So we're going to just touch on a few of these treatments, but there is a link at the end of this to a fantastic package on the Ascend website, which is called Foundations of Cancer, and it has some brilliant resources. It goes into the treatments in much more detail. It's kind of an e-learning package, so I'd encourage those of you who want to work through that in your own time, just to kind of give you that really firm foundation before you want to take cancer care reviews. So the intent of treatment can sometimes be curative, sometimes it can be palliative, and sometimes it can be more to keep people in remission for a long time. Many patients aren't completely cured from cancer, but some may be able to live many years with cancer in remission. So if you go to the first next slide. So chemotherapy. Oh, sorry, I've got some feedback from somewhere. Perfect, thank you.
Just go back on mute.
Thank you very much. So chemotherapy is probably the treatment that is most people would associate first with cancer. It is the use of anti-cancer drugs to kill cancer cells, and it usually is given intravenously. So patients usually have to travel to a hospital site or a setting like a Macmillan Centre to have this treatment. but it can be given in tablet form for some types of for chemotherapy treatment. So that is available, for example, for bowel cancer. It can be used alongside other treatments, so for example surgery or radiotherapy, and if you think about how the chemotherapy works, you can sometimes then go on to figure out kind of why the side effects might happen. So chemotherapy works by targeting cells that are rapidly dividing, and therefore it is able to shrink these cancer and tumors themselves. However, because of that, it also affects other areas of the body that have rapidly dividing cells. For example, hair follicles, bone marrow, and things like, your blood cells and things. So that's why, if you think about the early side effects, you think about patients may lose their hair, they might become anemic, they might drop their white cell count, so they might be susceptible to infections, and they might be affected quite badly by nausea, vomiting, diarrhea, constipation. And there's a huge range of different side effects that they may come across in their first kind of whilst they're undergoing that treatment. In terms of late effects, so later on down the line, and this might, when we're undertaking cancer care reviews, the ideal time to undertake them is actually once the patient's completed their treatment. So we may be seeing more of these late effects when we're doing our cancer care reviews. And these are things like effects on fertility. Patients might have their libido might be affected. Bone health is a really huge thing to think about when we're doing cancer care reviews, and encouraging activity is really important. And then secondary cancers. So some chemotherapy drugs can increase the risk of secondary cancers, which may develop, 8 to 10 to 15 years down the line. So it's important to recognise to kind of look out for signs of new cancers developing in these patients. Next slide, please. Radiotherapy is probably also equally as commonly used as chemotherapy, and is the use of radiation or X-rays to kill the cancer cells. That can, again, be used alongside other cancer treatments, and it can be either radical, so curative. It could be used as an adjunct, so before surgery to shrink a tumour. And it can be used palliatively as well, for example, in bony metastases from prostate cancers and other types of cancers to reduce pain. In terms of side effects, many of the general side effects are similar to those of chemotherapy. So patients might get nauseated, fatigued, and have effects on libido and fertility. Then there's also kind of local effects such as skin reactions, sore skin. Quite a lot of oral cancers are treated with radiotherapy, and it can cause impact on patients' salivation, and that can be quite distressing to a lot of patients. In terms of late effects, again, similar to those of chemotherapy, but some of those skin changes might become chronic, and patients might develop lymphedema if the radiotherapy has affected the lymph nodes, again, draining, for example, an upper limb, so they might get swelling of an upper limb. Next slide, please. And then finally, we're just going to talk about hormone therapy. Like I said, these aren't the only treatments available for cancer. We probably, those of you who already work in primary care and nurses in particular will have heard about a lot of these, because you might administer them yourselves. And these hormone therapies are used primarily in those cancers that are kind of fed by hormones, such as breast cancer, prostate cancer, and endometrial cancer. And again, if you think about how they work, so they block those hormones that help the cancer to grow. So these medications are fantastic at kind of keeping people in remission and keeping those cancers from growing anymore. They're not being fed by those hormones. But in doing so, in blocking these estrogen receptors and the testosterone and things like that, you almost induce a menopause in patients and affect those, the usual effects that estrogen would have. So if you think about that as then causing these particular side effects, they're very similar to those that are associated with menopause. So for example, hot flushes, low libido, erectile dysfunction and tiredness, and bone thinning and hair thinning. And these were like huge things that when we were doing our focus groups, patients discussed and actually said, you know what, it'd be really nice to have the opportunity to talk a bit more about these things, about erectile dysfunction and low libido, for example, because it's hard to bring that up ourselves. And if that was discussed in our cancer care review, I'd feel like I knew where to turn to for help. So that was just one thing that they really highlighted. Next slide, please. So as I said, there's a QR code here, which is for the Ascend training, which is a really brilliant e-learning package. I've worked through it myself, even though, you know, like I said, this has kind of been my thing for the last year, but I found it really useful just to kind of give that background in terms of kind of what cancer is and the treatments that are available. So you've got to sign up for a Learning Hub login, and that's free. And then you can just work through that e-learning module in your own time. And then the Manchester Academy website has some brilliant resources as well, but there's a module called What is Cancer? And that is, again, kind of the basics of cancer. So if you want to know more, that's where to find it. Thanks very much.
Brilliant. Thank you very much, Heather. And I just popped in the chat as well that we're pulling together a bit of a resource document. So if there's anything that you missed going along the way, then there will be links afterwards as well. But that's brilliant. Thank you very much, Heather. So if I can introduce Charlotte and Rebecca, welcome them both to come and provide the session on the physical impact of cancer.
Hi there. Yes, thanks very much. I'm Charlotte. I'm a physiotherapist, and Rebecca, my colleague, who's going to be talking as well, is a dietitian. We're both part of a team of allied health professionals over in Wigan. We work for Wrightington, Wigan and Lee NHS Trust, but we're based in the community. And we're quite a unique team, really, in Greater Manchester. We're very lucky in Wigan to have an AHP team dedicated to just patients with cancer or a palliative care diagnosis. So we're going to talk through the physical impact of cancer, and Rebecca's going to start us off. Over to you, Rebecca.
Next slide, please. Yeah, so this is a little bit of a whistle-stop tour because there are many physical symptoms of cancer. So we're just going to go through them fairly rapidly. So on the screen there, you can see some of the common physical symptoms. So poor appetite and weight loss, nausea and vomiting, constipation, diarrhea, pain, peripheral neuropathy, dry mouth, sore mouth, taste changes, fatigue, reduced strength, reduced function, insomnia, just to name a few. Next slide, please. So we were going to just talk through a few of these things, but first of all, we wanted to make it important to note the importance of how a lot of these symptoms, they're not kind of standalone symptoms. So we don't tend to see fatigue without weight loss or fatigue without reduced strength. So one symptom can have a knock-on effect and cause many other symptoms. And a lot of the causes, to say poor appetite, there's often many things that contribute towards that, so it doesn't often stand alone. And then that can have a knock-on effect too, leading to some of the other symptoms that we see, so things like weight loss, reduced strength, fatigue, muscle loss. Next slide, please. So we're going to start just briefly with poor appetite. So this is a really, really common symptom in cancer patients. I see it a lot as a dietitian. So the common causes, so I would say the vast majority of patients who have poor appetite are constipated. That's a huge factor that influences appetite. But also, to name a few others, nausea and vomiting, pain. If someone's in pain, they're not going to want to eat. Taste changes, fatigue, having the energy to stand and make food, or even just the energy to eat food, sore mouth, and a lot of these are often caused by the treatments, as Heather sort of did a nice introduction to that, and the reasons as to why that can happen. But also other medications can sometimes cause that as well. So consideration, so with appetite generally, trying to treat the root cause. So, asking why or what. So what's causing the poor appetite, or, why is that a thing? So is it because they're constipated? Do they need a laxative? Is it because they're feeling sick and then they don't want to eat? Do they need an antiemetic? Are they in pain? So trying to look at it from that angle can sometimes be really helpful. And then the practical advice for this. So this is my bread and butter as a dietitian. It's like little and often eating approach through the day, trying to fortify their diet. So we want full fat everything, we want full sugar, we want milky drinks, extra snacks. And first line prescribing is really important within primary care. So the powdered shakes are a really good first line option. So things like Complan Shake, AIM Shake, Food Link Complete. They're a really good way of just giving the patients an extra boost. and then obviously a dietetic referral as indicated. Next slide, please. So nausea and vomiting, again, so the main causes, so treatments, we know that chemotherapy can cause it, we know radiotherapy can. Again, constipation is a big reason why someone might feel nauseous, and pain is the other thing that can make people often feel quite sickly. So again, the considerations is treating that main cause. So, you know, why are they feeling sick? Is it because they're on the chemotherapy? It might not be possible to change that, but it might be because they've not opened their bowels for 6 days, and that might be increasing their nausea. So trying to treat that root cause. The advice, again, it's pretty similar in a way to the poor appetite advice. So little and often approach to eating. Ginger-based foods, getting some fresh air, staying away from food smells or things that make them feel sickly. Modifying the texture of the diet. We know that sometimes soft, sloppy options that don't take a lot of chewing can go down a bit easier if someone's feeling sickly. And then if you're thinking about an antiemetic for somebody, then just trying to guide them on the timing of this, that's really important. So looking at it from like a preventative approach, so maybe half an hour before a meal, that can be a really good time to take the antiemetic rather than just them taking it on a reactive basis when they're already feeling sick. Next slide, please. And then bowel issues. So lots of people have issues with their bowels. So there's many reasons as to why. So the main thing I would say is with constipation, it's often because of opiate-based pain relief or pain relief generally. So it slows the bowel right down. But also people, you know, going through cancer or after treatment, they're often not as active, their diet's changed, they maybe don't drink as much. All of these things have a big impact on the bowels and how quickly the bowel is moving. So things to consider. So, you know, which medication is appropriate for them. So can we change their diet? Can they become more active? Can they increase their fluids? The toileting position is a really big thing. So we want their feet on a stool, so raised up, so their knees are kind of higher than the pelvis if possible. If that's safe for the patient, that's a good pooing position and will help with constipation. But also appropriate laxative prescribing. So is it that the bowel is stubborn? Is it slow? Can they not push? If so, they might need a stimulant laxative, help move things along. Is it that they're pushing fine, but actually the stool is very hard and it's very dry? If so, they might need an osmotic laxative. So it's just trying to find the right option rather than kind of you know, general prescribing. So trying to find that root cause, what's the issue, and then kind of target it from there. And then with diarrhea, so, you know, the antidiarrheals, so things like loperamide can be really helpful. Again, this can have a knock-on effect to if someone wants to go out, if someone wants to move around, and then that can again have that knock-on effect to things like mobility, strength, fatigue. Next slide, please. And then mouth issues, so really, really common in cancer. So we know that chemotherapies can cause taste changes, and so can radiotherapies, but also dry mouth is a huge issue, and again has a knock-on effect to things like, you know, appetite, enjoyment of live food, all of those types of things that we like to do. And we know that a dry mouth is more prone to oral thrush. So it's really important to do a good oral care check. So just asking the patient, can I see your tongue? How does the tongue look? Is it coated? Is it cracked? That can tell you a lot about how the patient is doing. So the practical advice for this would be sort of monitoring, but also good oral care for the patient. So using maybe like a soft toothbrush with a small head. So like a baby toothbrush is sometimes really helpful for patients if they've got a sore mouth. Checking for any oral thrush and treating that as appropriate. We know that oral thrush can cause, you know, that claggy, horrible feeling in the mouth. We know it causes taste changes, and it can also lead on to cause some swallowing difficulties on some occasions as well. So that really good mouth care is really important. Some people find sucking on pineapple can be really helpful to help clean the mouth. And if they've got a sore mouth, then timing their eating. So trying to eat half an hour after the pain relief has been given. And that can be a real big help for patients that are struggling with that. Next slide, please. Charlotte, over to you.
Yeah, thanks, Becca. So apologies, this is quite a wordy slide, but yeah, quite a complex problem for patients is pain, and quite a common problem as well. So there's just a list there of some of the causes of cancer pain. A lot of what we see in our roles as allied health professionals is pain after surgery or pain after radiotherapy because of the damage to nerves and soft tissues. And also there's lots of different types of pain, which I'm sure you're all aware of, listed there. And this QR code here will take you to a Macmillan resource for pain, cancer pain, and it's a great one for patients to have a look at as well. And there's lots of booklets on there that patients can access themselves. But just moving on to the management of pain, it's always really useful to encourage a patient to keep a diary about their pain, because this will help us as healthcare professionals then to understand that pain in more detail. So how long they've had it, exactly where the pain is, the type of pain and the severity. Is it keeping them awake at night? How much impact it's having on their quality of life, really. So that's usually really useful. Then looking at the non-drug treatments and complementary therapies. So thinking away from just analgesia, really, and thinking about, have you got any options to refer someone on for instance, physiotherapy, because they might be able to prescribe a TENS machine or use acupuncture, which can be really helpful for cancer type pain. A lot of NHS services do provide acupuncture, so that's worth thinking about. And your complementary therapies such as meditation, massage therapy, heat packs and ice packs can also be really helpful in some instances as well. But also some anti-cancer treatments can help with pain, and that's obviously for someone's oncologist to decide. So sometimes surgery, radiotherapy and chemotherapy or nerve blocks can be done to manage more severe pains. But also I've just put in here to really think about the red flags. If someone's presenting with a new pain or quite an uncontrolled or unexplained pain as well, and that might need escalating and referring on. Next slide, please. So breathlessness is also quite a common symptom we see in cancer patients after treatment for cancer. Mainly to think about at first, it could the breathlessness be because of a reversible problem? So are they anemic, or do they have a chest infection first of all? But it might be something that isn't reversible, such as scarring or fibrosis in the lungs. With lung cancer patients, we see this a lot after extensive radiotherapy. Is it because their pain is causing poor expansion of their lungs and they're not able to get a good breath in? Is it because they're generally deconditioned, maybe? So for someone who's had a lot of cancer treatment, then they might have just been quite inactive over the last few months. Or is there a psychological element to it as well, which, you know, they're breathless because they're anxious and they've got an element of panic maybe as well. So thinking about the multifactorial causes of it. And then just thinking about some non-pharmacological treatments again, so referral to OT and physio teams in the community. Maybe complementary therapies would help again in this instance. Using fans, simple handheld fan, the feeling of air on someone's face can really help someone who's chronically breathless or acutely breathless as well. Looking at breathing exercises, visualizations. Are there any groups in your local area, things like that? And the occupational therapists are really well placed to help with things like pacing their activities, aid and adaptation. So consider what's available in your local area. And there's just a link there as well to the breathlessness information on the Macmillan website. Next slide, please. Peripheral neuropathy. I could have lumped this with pain, really, but I feel it's kind of quite standalone. It's a symptom we see a lot in our team. So this is often, well, this is caused by anti-cancer drugs. So that should say Vinca alkaloids, platins and taxanes. So if you notice someone's been on a chemotherapy, such as vinblastine, cisplatin, carboplatin, things like that, they destroy nerve endings, unfortunately. So you might hear people say things like, my feet are always cold, I keep dropping things, I can't do buttons up. It's those kind of fine motor things, or they've got problems with their balance. It can be a really debilitating and common side effect after chemo that can last a long time. But there is help out there for patients with these symptoms. So again, physiotherapy referrals for balance work. We're finding really good results with acupuncture treatment for this at the moment, and we sometimes use TENS as well, and our occupational therapists can sometimes see people for, again, aids and adaptations around the house if people are really struggling functionally. Next slide, please. So just to quickly mention fatigue, which is 60% of cancer patients after treatment report moderate to severe fatigue, and nearly all patients who've been through cancer treatment will have fatigue. So it's huge, and the main treatment for fatigue is actually encouraging physical activity, and it's kind of a lot of what we do is dispelling the myth that if you're tired you rest. It's the opposite with cancer-related fatigue. The studies show that the more active you are, the more energy that patients will actually have. So again, it's looking at what you've got locally, really, and we run a fatigue course. There might be something similar in other trusts, but again, encouraging the patient to use a fatigue diary that can help them to self-manage on what the patterns of the fatigue and what makes it worse and better. Physical activity, which I've said. We have council groups in Wigan that run like walking groups, active after cancer groups, things like that, really good for getting patients engaged with physical activity. Eating well, as Becca touched on as well earlier, can help manage energy levels. And obviously sleep is really important as well. Next slide, please. So this, you can read this after the session in your own time, but it's just a bit about insomnia and ties well in with fatigue. But there's some self-help tips there to improve sleep, and a link as well to the Macmillan resources. And that's it. Thank you. I think next slide is somebody else. Oh yeah, it's just us there. There's Rebecca's put some resources, some useful resources that you might want to look at there. And I think both Becca, well, I know I've got to get off, so I'll not be around for the questions and answers, and I'm presuming Becca has as well, but we're both happy for emails. If anyone has got any questions after this, just drop us an email and we'd be happy to help. Thank you.
That's brilliant. Thank you very much. Really nice to hear from two of our hugely valued allied health professions as well. So thank you very much for that. And yeah, any resources that you've put in there, we'll make sure that we pull into the document as well, so that it's easy access for all the delegates today. That's brilliant. Thank you so much for your time, both. So moving on, if I can introduce David Banks, so Information Support Manager at Tameside. Have we got David on the call?
Hi Jess, yes, I'm here. Can you hear me?
Yeah, I can hear you fine, David. Very warm welcome. I'll hand over yourself for the psychosocial impact of cancer.
Thank you very much. Don't know if Heather's joining. Oh, so it's okay to start, so we can move on. My name's David Banks. I'm manager of the Macmillan Information and Support Service at Tameside Hospital in Greater Manchester. And I've been asked to look at what the main psychosocial impacts for people affected by cancer. So we'll be looking at the needs and concerns that are raised. We'll be looking at the support that's available nationally and GM-wide, and we'll be looking at the local support and how to access these different strands of support as well. So we can move on from there, Jess. And if you can tap 6 times on this one, I'll try to be clever, and I should have done. Thank you. So the needs and concerns. So the way we work and the way we record data around access to our service is we use Macmillan's core data and recording records, tying into holistic needs assessments and the data from them. So it's split into 6 main areas: physical concerns, practical concerns, family or relationship concerns, emotional concerns, informational support, and spiritual concerns. If we can move on from there, next slide. And this breaks it down. So you see from those headers the wide strands of what goes into a person, the the basket of concerns and things that they can be bringing through to us. And some people may already have existing health and social care relationship or mental health concerns coming into the service even before the diagnosis. These concerns aren't usually helped by a diagnosis and the disruption to life. Sometimes they're compounded, but this is a really good way of breaking down from there what's going on. And what we would normally do with some of these recording tools is if someone comes to us with one primary concern or one or two primary concerns, we'd address those, but then we might branch out and in a sensitive way start asking about other needs and concerns that might be there in the background but not still affecting a person but not brought to the fore. If we can go to the next one, please. So the top concerns, what comes through initially to us from people that are referred. As a Macmillan Information and Support Service, we can be involved at any point in the patient pathway. The cancer care coordinators and cancer care reviews may happen at fixed points in time. For us, we're there from any point in time, really, pre-diagnosis right the way through to post-diagnosis or beyond. And the top concerns that come through from patients and on referrals are these. So if you just click, I would say, yeah, keep going till we get to complementary therapies if you can. Jess, thank you. That should be the last one. So the top three concerns, finances and benefits. Understandably, people get the diagnosis and they're worried about work or the effects that the condition will have on their finances. That's top there. How do I pay the rent? How do I pay the mortgage? How do I look after the children? How do I keep the car running? Those kind of concerns. So that's right there, right at the forefront. Then after that, it's transport and travel. How do I get from point A to point B? How do I afford that? And what supports around that. And then after that, we've got counselling and talking therapies. So as I said before, someone may be coming through to us that already has been living with a mental health condition and functioning with that condition. But this has all happened and everything that's going on, so it's compounded it. Or it may be that the shock of the condition and the diagnosis has triggered this. So they'd like more information on referrals into counselling and talking therapies, or they want to talk to someone in that environment as well. Surprisingly, from the data, one of the things that came up was complementary therapies. Big demand for that, and I'd say it's higher than that because we do. So it must be around 20% because a lot of people, the nurses, just book them direct onto this complementary therapies, and that's outside of these stats. So again, the big initial three would be around the finances, transport and travel, benefits, and emotional concerns, mental health concerns. Can we move on from there? So we're looking at what support's available, and I'd say the cancer care reviews and what happens, we do find that patients come back to us sometimes years after treatment, still dealing with the emotional effects and the fallout from the treatment, the trauma, the diagnosis, and the pathway through, and the effects that that's had on their lives. So we're there throughout that period, and at that point, these patients can call into or contact Maggie's centres, which are at Manchester and Oldham, the Christie's Information and Support Service, which is at Christie's Withington, Beechwood Cancer Care, which is in Stockport, and Macmillan Cancer Information and Support Services, which are across Greater Manchester, the North West, and nationally. There's usually a Macmillan Information and Support Service in the area. So if you do come across a patient which is completely out of your area, may have been getting support or lives in a completely different area of the country, it's worthwhile checking to see if there's support from Macmillan there. And if we can move on to the next page, please. And one of the resources and the tools that's there, so the Macmillan National Helpline and website. And we've got some resources there which are really useful. So the resource on the left, the green flyer, which is this one, is a fold-out sheet. Let's see if I can bring it to the camera. And it goes through, breaks down in a really clear and concise way the support that's available from Macmillan's helpline and online resources from Macmillan Cancer Support as well. And it's a really good way of making sense of a conversation, post a conversation, being able to tick the indicators so it points people to that and it shows them how to access it. So an example would be the free counselling service, which is available from Bupa and Macmillan Cancer Support via the phone line, the apps that are there to help with anxiety or sleep problems that are provided for free, benefits advice, energy advice, wills, much more, community groups and etc. that's all there, and it's available to anyone in Greater Manchester and nationally. And I think it's helpful to reinforce support that's available locally as well. And the other resource is this one. It's a hardback folder with A5 inserts, which goes into far more detail about all the different options for resources and support available from Macmillan. And you can also include, because it's a lever arch and snap open, you can include your local resources in there, so keep it as a personalised guide. And you can order both of those from the link on the slide there. It's ordersmacmillan.org.uk. Okay, Jess, if you can go to the next slide. So it's a wide area of supports available. So when we're looking at someone or working with someone, we won't just hit the big 2 or 3, if you like. It's about going back to the case, working out what else is available for the person, putting that together and then getting that across. So that then gives the patient the tools and resources to take some care of their own fate, if you like, or their own support. Accessing support, say, from some of the online groups, the Macmillan Cancer Support's online community. They have groups covering wide areas of travel and cancer. So if it's going abroad or finding an insurance policy, if it's a local, say, breast cancer support group, which here we have Bosom Buddies, which is on Facebook. It's trying to find those different areas that would help that individual person and getting that in a format that they can take away and use to support themselves into the future. So yeah, so it's looking at the national helplines. If we go to the next one, Jess. Apps. So I think as we move forward into 2025, and we're working far more with the online resources as well as the paper and hard-coded resources for people. GM Cancer has done a really great job at gathering together some approved or vetted apps that can be signposted to people affected by cancer. So it's Orca Help, that link on there, and you can see the different apps and how they can support people. And again, put that into that network of support that's available for people. And if someone's got the app on their phone, like the Sleepy or the Daylight app, it gives them the resources to start using that in a helpful way. Sometimes online resources can be considered maybe a little bit disruptive, but it's a two-sided coin. There's apps and resources and links that can be really, really helpful. Okay. Jess, if we can go to the next slide, thank you. Yeah, so online networks and forums. So Macmillan Cancer Support has the community.macmillan, which again is what I touched on earlier. So I do include that when I give people information on holidays and travel insurance and those issues, but there's also dedicated groups per condition, per area of concern, and they are vetted and well maintained. So it's a trusted resource that we can give people to link in with and start sharing their needs and concerns online. Not everyone can get to a support group. If you're working or you're just unable to get out of the house, it's good to give people these resources as well to access. And you've got Cancer Research UK's Cancer Chat, Maggie's, and Joe's Trust Forum. As Joe, oh, well, thank you very much for that. Just in the chat, Joe's closed down. So anything that's out of date on here, please do let me know and we'll update it as we go. Yeah. If we can move to the next one, please. So again, the charities on social media, and there's some links there to the different charities that are available on the social media to follow. And I think the social media ones are useful as professionals if you have your own Facebook page or Twitter page, to link into those as well. We'll move on from that one. Again, and so yeah, this is more of a list of different support that's going along, and thank you very much for that information with the Eve appeal as well. Yeah. Thank you, Jess. If we can go to the next one. Online videos, and this is one that I'd like to do more work on locally, is to be able to give people the links to the videos that would be helpful to them. So we've got some here as examples, the NHS 1U around the exercise and support, and this is about building that wider support. So I do believe we should have support that's available face-to-face. We should have resources that people can draw on and use themselves, and we should have videos and online resources that people can access to support their recovery and well-being as well. So with videos making up over 80% of all online communications, they are a great way of spreading the support that's available. Really, not everyone can provide a bespoke yoga class face to face. But if you can provide a link to a suitable online resources that people can do in their own home, or the gentle exercise, or the support around well-being, then I think that's a really good thing to do. So again, if we can move on from there, thank you. Yeah, and these again, more resources and support is available online. Yeah, and the cancer research. So thank you very much for that, Jess. This one. Accessing local support. There's a wide range of different support and different knowledges out there. I think being able to link into a local, so the amount of support that's available online that you can find is sometimes overwhelming. So that's why I think the resources available from Macmillan around their support and your local centres of support as well, because they're the people that are doing it every day. They're the custodians of what's up to date and what's happening. And it may be that it's something new that started that's not on Cancer Care Map. But to find the support that's in your area and make those first steps, cancercaremap.org is a really good one, as is macmillan.org UK in your area. Both of these should show you the local resources and points of contact available, and they're really good to find your local information and support service or Maggie Centre or point of support that's in your area. And I think I might have pulled up short there, Jess, but is that okay? Is to explain the wide range. Predominantly, it's psychosocial, it's emotional, and finances are the ones that come through. But that is the gateway, if you like, into us, the crisis points. From there, our job really is to map out, address those critical areas of concern, but then map out the wellbeing and map that's available for people affected by cancer. There is a difference as well from the initial approach where you're dealing with someone with a curative condition or a carer or their friends and family, as opposed to someone with a long-term palliative condition, or as to someone that may have a shorter term palliative care. The approach changes quite quickly, but initially the two concerns will be the same: finances and benefits and emotional support. Thank you very much.
That's brilliant. Thank you very much, David.
You're
Thank
welcome.
you for that. And so helpful as well to have everything in one place. So we'll make sure to pull all of those out into the resource pack as well. That's really helpful. Thank you.
Yeah. And just quickly to Leanne, who said Citizens Advice is an excellent resource. Citizens Advice is doing lots of work with Macmillan Cancer Support. So you will find across Greater Manchester that they're covering almost half of Greater Manchester with Macmillan specific advice and support that you can refer into. If you're not sure how to refer into them specifically for that, link in with your local Macmillan Information and Support Service, or just ping me an email and I'll show you how to access it. Thank you.
That's brilliant. Thank you so much, David. Thanks very much for your time. Right, that's brilliant. We're banged on time as well, which is great. So I'll hand over to Miranda for the next session from the personalised care team here at the Alliance. Thanks, Miranda.
Great, thank you, Jess. I'm Miranda Breen. I'm one of the personalised care managers with the Alliance, and I've been working with Heather on this cancer care review improvement project, and I'm just going to talk you through some of the resources that we've produced and also the rationale behind doing so. So could I have my first slide, please? Thank you. So the definition of a cancer care review is that it is a holistic conversation between a patient and a member of the GP team about their cancer experience and the impact it has had on their life. And in terms of holistic, we define this as looking at the whole person, considering their physical, emotional, social and spiritual well-being. And as we've seen already, the experience of cancer can vary significantly from one person to another, and so can the impact that that cancer has on their lives in general. Next slide, please. So we're going to look at why cancer care reviews are so important. So research by Macmillan Cancer Support found that after a cancer diagnosis, approximately 83% of people reported that they were less well off, as David has already alluded to. 2 in 5 tell us that they've experienced symptoms of depression. A quarter report that they experience loneliness, and anxiety affects around possibly more than 75% of people. And 26% of people experience difficulties in their relationships following their diagnosis. So these difficulties and many others can be long lasting and impact greatly on a person's ability to live well beyond cancer. Many people are discharged by their treating teams, as Heather's mentioned earlier, following the end of their treatment, or are only seen once or twice a year for follow-up. Next slide, please. Patients report a sense of falling off a cliff. Hang on. Falling off a cliff at this point, with little to no support provided to them after the intense care they've received while they're undergoing treatment. So they see a cancer support nurse all the time. They have regular contact with their consultant, and then all of a sudden they finish their treatment and oof, they're on their own. So patients really struggle with this. But there is support available out there. However, patients really struggle to find out where to turn and where to find out about that information. And this is obviously where the Cancer Care Review comes in. It provides an opportunity for primary care colleagues to address some of the issues that have been mentioned earlier, like the physical difficulties that patients are experiencing or severe psychological distress. And it also provides a space for signposting to local resources and also online resources, as David has mentioned. Next slide, please. So I'm just going to go into the sort of official requirements for cancer care reviews. These are governed by the quality outcome framework, and there are 2 indicators that highlight the points in the cancer pathway, which can be a key time of need for patients. So the first is CAN 005, which requires patients that patients should receive an offer of a cancer support discussion and information about the support available to them from primary care within 3 months of their diagnosis. And then we have CAN 004. I've no idea why they're the wrong way around. It's very confusing. And this one requires that every patient should be offered and, where applicable, provided with a cancer care review delivered using a structured template. So both of those indicators are quite specific in what is expected of the primary care support during the first 12 months post-diagnosis for cancer patients. Next slide, please. So in Manchester, our QOF data suggests that around 98% of patients in the area are receiving a cancer care review within 12 months of diagnosis. However, anecdotal evidence suggests that the understanding amongst primary care colleagues of what constitutes a cancer care review varies significantly. In some practices, patients are invited in for a comprehensive conversation to understand their personal experience of life with and after cancer, and to discuss the impacts and their needs going forward. Whereas in other practices, a clinician can simply review the notes on a screen and enter the code for a cancer care review. So both of these interactions are recorded as a cancer care review. Which obviously means that there's a huge variety and variability in the way cancer care reviews are delivered across Greater Manchester, and therefore very variable experiences for patients and different variable value as well to patients. Next slide, please. So to address this variability in the delivery of cancer care reviews, the personalised care team and Heather undertook this quality improvement project with the aim to improve the value of cancer care reviews to patients living with and beyond cancer in Greater Manchester. So our project has got 4 elements, which I'm going to talk you through one by one. And these are to develop standards for cancer care reviews to improve the quality of how they are delivered, designing a protocol for practices to help to support the CCR process, and developing an improved cancer care review template on clinical systems to facilitate quality cancer care reviews. I will switch between cancer care review and CCR, but they mean the same thing. And the final element is why you're all here today, which is to design and deliver an educational package to upskill practice staff to deliver high quality cancer care reviews. So thank you for joining us. Next slide, please. So the cancer care review standards it's quite a long document. It's a couple of pages long, and I've just highlighted a couple of the sort of crucial elements here so that you can understand what we're hoping to achieve through delivering these standards. So the document recommends that there should be a robust system for achieving the QOF deliverables, achieving the QOF targets, including using the newly developed new diagnosis letter, which I'll mention in a couple of slides' time, and ensuring that staff undertaking reviews are appropriately trained and confident in delivering those reviews. So the standards recommend that cancer care reviews should be pre-booked as a standalone appointment and not included as part of an existing consultation, because discussions with patients made it clear that sometimes they have been ticked as having received their cancer care review because at the end of a consultation about something else, someone said, "And how are you getting on with your cancer?" So this is to attempt to make the appointment all about the cancer care review, to give the patient time to discuss the impact and needs that they have. The process should be patient-led, and the timing of the appointment, although it is required to be within 12 months, the actual specific timing of the appointment should be patient-led and based on their needs and decided by them to be appropriate in time. We recommend that practices should allow at least 20 minutes for each cancer care review appointment. And prior to the appointment, we recommend that end of treatment summaries and any other documentation from the treating team are looked at and read to give you an understanding of the patient's background and their experiences. This ensures continuity of care and also avoids the very unfortunate experience patients have of having to repeat their story from one team to another. So it provides the patient with the sort of confidence that you already know a little bit about them. The best practice would be that the cancer care review is the first step in a continuous review process, which would ensure that the patient is supported beyond that first year. This isn't within the QOF targets, but we, as Heather mentioned at the beginning, there is significant evidence to suggest that really cancer is now a long-term condition and should be treated in a similar way to diabetes and hypertension. Next slide, please. So we've developed a cancer care protocol, which essentially provides a visual representation of the CCR process for practices. It outlines the points at which the practice should be reaching out to patients, and it also includes recommendations around coding and diary management and links to other resources that might be useful during this process. This slide is not the full protocol, it's just a simplified version which highlights the central processes. So we have the coding of the new diagnosis, the sending of the letter which satisfies that first QOF requirement, then an invitation to the cancer care review, and then the delivery of the cancer care review as a standalone appointment, which is satisfies QOF CAN 004. And then obviously, as I've just mentioned, the idea is that that becomes part of a long-term follow-up within primary care for these patients. Next slide, please. So our new diagnosis letter has been developed with in collaboration with patients to be sent to patients on diagnosis, because QOF CAN 005 requires that patients should be contacted within 3 months of their diagnosis to be offered support by their GP practice and details of available support in their area. Now, some practices we are completely aware of have their existing systems in place. Many clinicians like to phone their patients to talk to them quite soon after their diagnosis, and this is not, we're not suggesting that this letter should replace that process at all, but we have just provided another resource for practices to use, which can be sent using searches within the clinical systems to ensure that every patient who has been diagnosed with cancer is provided with the same information. The letter offers patients the opportunity to have a phone call or appointment to discuss their support needs if they have any, and it provides resources on a national scale for patients, but it also provides an opportunity for practices to fill in their own information and any local groups that they particularly want to highlight. If you take a look at our website, the letter can also be downloaded in easy read format, and we've had it translated into 19 of the most commonly spoken languages as well. It does sit on the clinical systems. It was uploaded to the systems in April, so everyone can access that letter now. Next slide, please. And finally, we come to the template. So we receive feedback from users of the existing cancer care review template that it's very clinical in its focus, and that it doesn't really facilitate a personal, holistic discussion with the patient. It talks very much about medication and the physical impact of cancer, but not particularly around the psychosocial elements. So we worked with colleagues, including cancer care coordinators, GPs and practice nurses and patient representatives, to develop a new template, which is based on the Macmillan template, but goes a little bit further to support a truly holistic and personalised cancer care review. Now, this has been uploaded to all practice clinical systems over the summer. And is available. Heather's going to talk you through how to use it and how it works, so I'm not going to say any more about that. Next slide, please. And I just wanted to wrap up by providing some resources, which I'm sure Jess will include in the final pack. So if you go to our GM Cancer website and navigate to the Personalised Care in Primary Care section, you will find the Cancer Care Review Toolkit, which provides information about all the elements that I've discussed, and also is where you can download the various documents to support the process. So that's a wrap, really. Thank you very much for your time, and on to Heather.
Thanks very much, Miranda. That's brilliant. And just for anyone on the call as well, I've just put the link to the website in the chat function as well. So just in case you wanted to have a look at that whilst Heather's talking and use it alongside, that's brilliant. But thanks so much, Miranda. Straight on to Heather. That's brilliant. Thank you.
Thanks, Miranda. Brilliant. So if we go to the first slide, as Miranda said, we've been working on this template for quite a while with patients alongside clinicians as well, just getting a really good overview of what patients like to discuss during their cancer care reviews. Obviously it's a personal choice whether you decide to use a template or not. Some people really like using templates, whilst others might kind of prefer to just kind of use it as prompts or a bit of or prefer just a freehand discussion. But generally what we tried to do was create a template that had a bit more freehand or free text entry rather than it being more tick box. And I find it useful as a prompt, really, in terms of the different things that patients might wish to discuss. And the final page of the template has a really useful resources page where you can direct patients to support. And even if you just open a template for that, you can copy and paste, or you can open links with the patient in front of you and copy and paste the link for those resources into a text message to the patient, and that can mean that they can then access it on their own phones. Most importantly, as Miranda said, the cancer care review is patient-led, and in the end, you know, templates can be sometimes thought to be quite restrictive. But what we've tried to do is make this much more holistic in its approach. Next slide, please. Perfect. So Miranda said a little bit about this already, but what I like to try and do is, before you start the cancer care review, is to gather some information, first of all, about the patient. It might be that, for example, if you're a practice nurse undertaking the cancer care review, you've met this patient and their family members multiple times before for their COPD reviews or their diabetes review. And that's another reason why nurses may be very well placed to undertake these reviews, because they often know they follow these patients on a yearly basis. But first of all, gather a bit of information about the patient themselves. So look at their comorbidities and any chronic diseases that they might have. Do they see someone regularly for those, or have they had any recent acute admissions, for example, to hospital? Secondly, I tend to look at the medication list. Again, you might do this in a slightly different way, but this is just talking through kind of how I would go about it and how you would then use the template. So look at the medication list. Have there been some hospital medications that have been added to the list? Sometimes they are added by the pharmacists in terms of kind of, you know, they're provided by the hospitals, but it can be visible on the medication list as well. Thinking about any social things that you can see on the patient's records. So are they a carer? Do they smoke, or do they drink a lot of alcohol? And again, it's good to know this in the background before you see the patient, because it just puts you in the right stead to kind of approach some of those in questions later on in the review. And then finally, just looking at the bottom kind of right box, which is some of the alerts. Quite often you can imagine why, if a patient's been diagnosed with cancer, has all these appointments to attend, they've been going through treatment, it's quite understandable if they've forgotten to attend their COPD review or their asthma review or even the cervical screening. So having a look at that alerts box and thinking, oh, actually, do I need to remind this patient that actually they are due, overdue their screening test, or it would be good to kind of, get them in for their COPD review, so that these things don't kind of fall by the wayside, and that you're kind of looking at the patient as a whole rather than just the cancer itself. And then finally, once you've kind of done that background about the patient, then thinking about the specific diagnosis and the treatments that they've had. So I tend to look at the last hospital letter or the last couple of hospital letters. And what I've found is that clinicians usually now, or the secondary care clinicians usually now, summarise all the treatments to date and the dates when they happened, and any kind of recent investigations that patients have had, which is actually really, really useful. And it helps you to see, oh, actually, has this patient just had a scan to show that the cancer's recurred? And that might, it's good to be in the picture of what's gone on before the patient then kind of comes in, or you make that contact via the phone. There's some work being done in terms of kind of making end of treatment summaries and holistic needs assessment more visible to primary care clinicians and people in primary care. The end of treatment summary is a document when patients have finished their treatment and almost been discharged at the end of their treatment, and it summarises everything that's happened and the investigations that they've had, and the treatments that they have. But importantly, from the point of view of primary care and the onwards management of that, it also highlights what long-term effects the patient might have from their treatment, and any symptoms and signs of recurrence of that cancer or secondary cancers. The patient usually has a copy of that end of treatment summary, where there's work being done to try and make that more visible in primary care as well. And then the holistic needs assessment, if you've not come across that phrase before, that's an assessment that's done towards the beginning of a patient's cancer journey in secondary care. And that's, again, looking quite holistically at their concerns, what's important to them at the time of the diagnosis. So if we're able to see those in primary care, which again is another area of work, then we could look back and see, oh, actually, this is something that the patient might want to discuss. And then finally, there's a Macmillan Concerns checklist, which some practices might want to kind of send out to their patients before the cancer care review, and the patients can it just helps them to prompt to think about what's important to them at the current time. So next slide, please. So as I've said, there is more than this template available. So there's a Macmillan Cancer Care Review template, and that is still available. And if you're familiar with using that and like that template, it's absolutely fine to continue to use that. But we wanted to give people a choice of using something with slightly more freehand, if that's something that you prefer. So just if you could click, please. And again. So if you look at the template picker on EMIS, and then you type in GM cancer, it will come up with the GM cancer care review template there. And if you click on that, it will open. If you could go on to the next slide, it'll open the template, which looks a little bit like this. So this first page is the kind of the real meaty bit of the cancer care review. So there's quite a lot on it. And again, you might want to approach this in a just real conversational way, and then enter details later on down the line. So after the patient's kind of completed the review process, or you might want to go through it with the patient there and kind of fill in each box as you go along. None of the boxes here are forced entry boxes except for the final on the final page, which is the QOF point entry, which is the cancer care review completed box. But generally, it's these were areas that was discussed with our patient representatives as well, to be areas that they really would like to have covered during their review. So first of all, what we've done is we've included a little bit about the cancer and the patient's understanding of the cancer treatment so far. So that's in the top bit of this this page, and there's a summary of the cancer diagnosis and the treatment plan. Select what cancer treatment the patient is on, and there's a drop down there to say whether they've had chemotherapy, radiotherapy, and there's an other as well, because we couldn't really include everything. And then finally, kind of where has the cancer care review taken place? Many patients like to have that review face to face, but these days quite a lot of the review are done over the phone as well. So that's up to the patient again, and that can be patient led. The second kind of element of this page is looking really at the symptoms and the psychosocial impact of the cancer. And I've started by kind of asking that general broad question of what matters to the patient the most at the moment. And usually if you ask that question, they'll then go on to kind of, talk about, all the things that are concerning them at the moment. But it's good to just gauge actually what's most important to them. And again, being that kind of patient-led element of it. So what's most important to the patient currently? And then thinking first of all about the physical symptoms. So are they struggling with neuropathic pain? Are they really struggling with insomnia or fatigue? And thinking back to kind of some of the things that Charlotte kind of presented in her presentation, there's so many ways to manage that doesn't involve medications or a kind of a prescriber. There's so many ways in terms of pacing and holistic treatments, but also signposting to the amazing resources that are available. And I was absolutely kind of shocked at what is available around Manchester. It's fantastic to see that there are places we can send these patients to where they could be able to receive that real kind of support. But it's just knowing where to turn for that help. You don't need to know all the answers to do a cancer care review. It's just to know where to turn. So physical symptoms, and then thinking about mental health and emotional well-being. So as David said, and Miranda said as well, in terms of anxiety and depression, really common during and after a cancer diagnosis. So it's important to touch on that and to ask a patient how they're doing mentally. There are brilliant, again, signposting resources that David mentioned. Obviously, if kind of something significant is raised in terms of you're worried about this patient, it might be worth kind of, if you're speaking to a GP at your practice to say, does this patient need a kind of a mood review and a support for their depression in terms of medications. Thinking about social well-being, so what kind of support does that patient have? It's always really reassuring as a clinician to kind of have a patient who is well supported by family, friends, they go to knitting groups and all of those things. But this question can really highlight patients that don't have that support and who might need social prescribing, for example, to get kind of to help with them with that social isolation. Which can be exacerbated after a cancer diagnosis if, for example, patients become frightened of going out because they're worried about, for example, infections, or they're troubled by pain. So thinking about that social aspect. And then work and benefits. So is the patient in work currently, or do they need a fit note? So patients might want fit notes during their treatment or afterwards if they're struggling to get back to work and can't do because of certain symptoms. But also thinking about amended duties note. So, actually, is it really good for that patient to get back to work, but it might need a few workplace adaptations for them to kind of have that discussion with their workplace. So again, you might be able to then flag up that patient needs a fit note, and what benefits are they able to access as well, or do they already access that benefit? If they're not sure what benefits that they are eligible for, I personally struggle to remember all the different types of benefits that are available. Again, social prescribers or clinical advice bureau are really good places and people to kind of help offer support in that area. Spiritual well-being, again, not important for some patients, but actually hugely important to others. if, for example, a patient's not been able to get to their place of worship because of a physical issue after their cancer diagnosis, or again through fear of kind of being in big groups and infection, for example, this can really have a massive impact on the patient's well-being. So ask the patient, do they have a faith, and how has that been impacted by their cancer diagnosis? They may be able to say really encouraging things about the fact that they've been able to draw upon that at really difficult times. So it's just a question that's really useful to ask as well. Finances, have they had problems getting insurance, for example? Are they really struggling to pay for public transport now that they're not able to drive for certain reasons? Are all the car parking fees adding up, things like that? And again, signposting them to particularly some of the Macmillan resources are absolutely fantastic on this, which David mentioned before. And then finally, one of the areas that our patient representatives really kind of said, this is really important to talk about, and it's really important that we ask it in the cancer care review, because many patients struggle with it but don't actively come and talk about it, is sexual well-being and relationships. So as we said previously, so many of the side effects impact on this, and so many of the treatments impact on this. And so asking the question, patients will take it further if they want to take it further, and if they don't want to discuss it, they'll say no. But it's important to ask the question, have you felt your sexual well-being being impacted by your cancer or your cancer treatment? So that's kind of the meat of the kind of the physical and psychosocial bit of the cancer care review. And then, as we said, kind of in thinking about the lifestyle factors, so again, important to think about these, because actually beyond a cancer diagnosis, patients might have had an impact on their bone health. So thinking about physical activity being really helpful for that and helping them to not get osteoporosis. Thinking about diets. So again, trying to prevent kind of them losing lots of weight. That will help them to feel stronger and feel less tired, and those pacing of activities as well. So the guidelines still stand that kind of 150 minutes of monitor activity a week for patients. And I think David mentioned the 5K your way, for those that want a little bit more of a challenge. But at the cancer conference this year, there was some brilliant stalls about 5K your way, and it's really made a huge difference in both kind of the emotional well-being and the physical well-being of patients as well. So that's just something to kind of highlight to your patients that you see. Is the patient still smoking? If that's the case, obviously offering them some smoking cessation advice is really important, because thinking about kind of their long-term prognosis, the recurrence rates, and also their ability to kind of rehabilitate from the cancer treatment is hugely impacted by things like cigarette smoking. So again, important thing to ask and just touch on in your cancer care reviews. So next slide, please. So this slide thinks about care and social prescribing. And again, one of the big issues highlighted by some of our patient representatives was that although they felt that they were kind of looked after by their secondary and primary care teams, they felt that their carer, so for example, if they were being cared for by their wife or spouse or by a good friend, they felt like their needs were not addressed. And that's why the question of have you got a carer, or are you yourself providing care, is one that's quite important to think about during a cancer care review. And actually there's some really useful resources available for people who are carers. And things like the Maggie's Centre, they have great support for people that are caring for someone with cancer. So again, that's just important to talk about. Who's the patient's next of kin? It's worthwhile putting down their name and their number, and do you have permission to contact them or talk to them about the care, or if the patient's, for example, not available at any particular time. Is there an emergency contact that is different from the next of kin that they want to put down there? One of the things I always find is really useful is to know the number of the cancer care specialist, because sometimes they're always brilliant people to speak to, and if you've got a query or a question, And if the patient knows that number and who their cancer care specialist is as well, or the cancer nurse specialist, it's really useful for them, and they feel like they know where to turn. So have you been able to find that in one of the letters, or does the patient know it themselves? And if you summarize it here, it's then saved in EMIS, and if you look back to the cancer care review, it's all a lovely summary, and you can then easily find it later on down the line if you want to just quickly kind of ring or leave them a message to ask a quick question. So finally, this page looks at the kind of any support needs and areas of needs, and social prescribing. So social prescribers, we've got some of you on the call, on the webinar today. So thanks for all the work that you do, because somehow you managed to retain all the information about all of these things that are happening in Manchester, and it's fantastic to be able to refer patients to you. So if you've identified a particular area where patients might value just a bit of extra support or signposting, or you're not quite sure where to go with something, but you know that a social prescriber will have that information, offer that to the patient. And then different practices will have different ways to do this. So I know in my practice we have to task the secretaries to do the social prescribing referral, but other practices might work in different ways, and just obviously getting the patient's consent to do that, but then hopefully they'll be able to tap into any local resources that are available via the social prescriber. Next slide, please. And Macmillan mentioned that a medication review is kind of a good thing to include on the GM cancer, in the cancer care review. Now, obviously, if you're not trained to do a medication review, you might prefer to then book that patient in, or highlight to that patient that they need to book in with a pharmacist, for example, or another clinician. But have a look to see whether they're due a medication review. Have they got new medications? Are they up to date with their ordering on their current medications, on their repeat prescriptions, or actually have they not been taking their antidepressants for 3 months because they've forgotten about it because they've been having cancer treatment? So it's worth asking a few questions about their medications, but generally, if for example you're not trained to do the medication review, but they're due one, just prompt them to then arrange that medication review via the reception, or however you would usually do that in your practice. In England, patients' prescriptions are free for anything related to cancer or its effects. So there's a form that's available for patients to complete. And if patients don't already know about that, obviously highlight that to them, because that could take a big load of financial strain off them, and can be hugely important. And you would hope that they would know about this by the time they come and see you in your cancer care review, but it's not impossible that they will come and have been paying for prescriptions for their time before the cancer care review. Next slide, please. So finally, just a bit of a summary box at the end, which includes kind of you offering links to local resources, which goes on to the kind of the next slide, which I'll talk about in a minute. And you can kind of tick that box and say, oh, you signposted to the Maggie's Centre, and send them a leaflet on insomnia or something like that. And then I always find it useful to put a bit of a summary box. So you might have talked about a huge amount of things, but in summary, you might want to say, okay, well, that you're going to do a fit note, or you're going to ask the GP to do a fit note for them. They're going to make follow-up with you after their next round of treatment, and whether you've offered any follow-up for them in terms of kind of a touch base at the practice, which I know patients can find really, really valuable. Is someone off mute, I think. So finally, as I said at the beginning, the only forced entry of this template is this cancer care review completed box, which if we're able to click onto the next slide, it will nicely tick here. But that's the forced entry box, which will be which is the one that will get the QOF point. So if you go to the next slide, if possible. And this is just, like I said, some of the resources. David's kind of put all of those brilliant resources that are available, and so did Charlotte as well. But these are some that are available through the template. So as I said, you can click on these links. It opens up on a web page. You can copy and paste the email address or the web page address, and then text it to the patient. So it's a really useful way to access these resources. What I've done is I've kind of split it into kind of nationwide support and information. So Macmillan Support and Cancer Research UK. So that's just straight to their webpage, their home pages. But then I've looked and hopefully we'll be able to add to this as time goes on. But there's some specific leaflets here or specific pages on some of the most common physical symptoms, such as hot flushes, fatigue, pain, anxiety, and insomnia. Most of those are Macmillan. I think some of them are Cancer Research UK, but they're generally really accessible for patients. There's some stuff on money, finances, and insurance, because insurance is a big thing for a lot of patients in terms of getting travel insurance after a cancer diagnosis. And there's help and advice on prescription costs as well there as well. The Macmillan's Wellbeing Hub, David's already talked about that, so I'm not going to go into that in much more detail, but that just highlights things about diet and exercise and self-care. And then one resource that I find really, really useful is the Cancer Care Map. There's a picture of this on the next page, but you just basically, I generally copy and paste the patient's postcode, put it into the Cancer Care Map, and then up comes a list of all the kind of local groups that are as close to the patient as you can get, basically. So that might be Macmillan Centres, but it might also be the local prostate cancer support group, for example. So it's really useful, and that's kept up to date, which is always nice. Another couple of resources there, obviously Tameside Macmillan unit is more for patients in Tameside, but that does see patients beyond as well. So next slide, if possible. Fantastic. So these are just some of the resources that are available. As I've said, that's top left is the Cancer Care map, which is really helpful resource, and I use quite a bit actually. And if you go to the next slide. This is what it looks like once you've completed the Cancer Care Review template. It does kind of look like a lot of text, but actually on a screen, the screenshot doesn't give it justice really, but you've got the bits in bold, which is things like your social well-being, and then you've got your, whether they've got good social support. It would possibly look a little bit more meaty than this, but this is just one that I filled in just for an example. You've got your social bit there, which is nicely summarized and has like some information on what you've discussed with the patient. And then you've got your kind of final plan agreed with the patient in terms of what follow-up you've advised and whether you're doing things like fit notes and things like that. I usually then add a problem heading, so that will probably be like the type of cancer that they've had. So for example, lung cancer. And I find it really useful then to be able to look back at this. If you do a quick search and search Cancer Care Review on EMIS, it'll then bring up their Cancer Care Review, and it'll basically be able to look back at this and see what discussions were had. Next slide, if possible. I'm not going to talk about communication skills because everyone will have their own way of doing things, and everyone has their own great skills in this. So, but some people highlighted when we were designing the template that they might find it hard to approach the question, for example, of people's low libido, or because they might not feel personally they were able to kind of advise very much on that. Hopefully some of the resources that we've given today will make you feel that certainly you're never alone in anything that's raised by a patient, because there's so much out there, and it's just about knowing who to turn to and where to turn to for that help. But how I generally go about it is saying, it's kind of generalizing it and saying that after a cancer diagnosis and treatment, many people find that their cancer or the treatment itself has an impact on your finances or your sexual well-being or your mental health. And is that a problem for you right now, or is that just something that's troubled you, and do you want to talk about it today? And I think that's like one way of getting into that kind of conversation without kind of it being a really kind of direct question, and it kind of leaves it open for the patient to talk about it if they want to. But there's many other ways that you might want to approach the questions yourself, and you'll find your own way of doing it if you're going to start doing Cancer Care Reviews, which I'd encourage many of you to do. And I think that's it for me. Thanks very much.
Brilliant. That's great, Heather. Thank you very much for that. And I think we're on to the last session, which is me. This is the final session before we move on to the question and answer session. So it was just a bit of an opportunity to provide some of the impact really in terms of what a good cancer care review can do, and what the benefits are for the patients, but also for your primary care network as well. So my name is Jess Doxey. I'm the workforce programme lead here at the Cancer Alliance. If we just pop on to the next slide, we're just going to make a start with a video from Elizabeth, who is the practice nurse at Duckingfield Medical Practice, just around her experience of cancer care reviews and doing those with patients within her practice. So that's great. Thanks, Susie.
Hi, my name's Elizabeth and I'm a general practice nurse. One of my roles is doing the cancer care reviews at the surgery. I've been doing these reviews for several years now and I really enjoy doing them. I did a 2-day Macmillan cancer care course about 6 years ago and started doing the reviews after that. When the surgery gets a serious case notification, it is shared with me via DocMan. I then wait until the patient has had a meeting with their consultant and cancer nurse specialist. I then book a telephone call. I let them know that we have received notification and that we are aware of their diagnosis. I let them know that I can be their link at the surgery while they are going through their treatment. I offer regular contact throughout their treatment. Some accept, some are happy with the support they're receiving from the cancer nurse specialist and their friends and family, but I let them know they can still book with me to call them if they have any questions or queries. Everyone has been very grateful for the contact and appreciate contact from the surgery. I have about an hour a week to make these calls, and it's usually enough. I chat about how things are going with them, with their treatment, how family are, whether they work, are their employers supporting them, do they need sick notes? If necessary, I can link them to the local Macmillan support, with Maggie's, with local charities. I also have emails for the local cancer nurse specialists. They are always quick to respond and very helpful. I'm not a cancer expert, but I do say that I am happy to help and I can often point them in the right direction. I can help order prescriptions, I can help them ordering sick notes. Having had personal cancer journeys, both myself and family, I feel I can speak with experience. Although I rarely share my own story, I hope I can express empathy. I feel privileged to be able to speak to people in a really difficult time. I hope to be able to share a sense that the surgery cares about them, especially through their treatment. I don't get involved with end-of-life care. There is already lots of expertise and people doing this very well. Although I speak to everyone, I really like keeping in touch with the people who are having curative treatment. I do try to contact everyone again 6 and 12 months after their diagnosis. With more people surviving cancer, I feel important to support the survivors after their journey. I really enjoy doing my cancer cares reviews and I hope this has given you a little bit of insight into what I do, and why not give it a try? Thanks.
That's lovely. So big thank you to Elizabeth as well for recording that video for us today. And just to really reiterate here as well that, you know, Elizabeth doesn't work in cancer. She's a practice nurse at her own GP practice. So somebody who, you know, is not a cancer specialist, but still able to make a real impact on cancer patients is great. So we've just put in here as well some patient feedback following a cancer care review with Elizabeth. So I'll just give you a little bit of time to read that. But I think what's, you know, clear to pull out from here as well is that there's a real personalised care element to their experience and what they've really gained from that in terms of a cancer care review with somebody who's not a cancer specialist. If we can, oh, that's brilliant. Thank you very much. So I just wanted to share some outcomes of a project that we did here in Greater Manchester as well. So it was run by GM Cancer, piloted 9 cancer care coordinator roles as a bit of a blended role between primary and secondary care within personalised care networks across Greater Manchester. So it was an 18-month pilot initiated back in April 2022. It was multi-partnership, so it was with the Workforce Collaborative, the then HEE and Macmillan. And what the cancer care coordinator role aimed to do was be a single point of contact for for patients within their primary care network, to conduct cancer care reviews, to support patients to self-manage their condition, and to provide that seamless personalised care. So the aim of the pilot was to measure the impact really in terms of what that support role can do in addressing the increasing number of cancer survivors that are requiring follow-up, and also deliver that NHS long-term plan and support the delivery of those elements of the NHS comprehensive model for personalised care as well. So if we just move on, I've just done a slide around some of the sort of outcomes and the impact. So that pilot, over the 18-month period, we saw a large volume of cancer care reviews that were completed, and an increase in the number of cancer care reviews when we did a year-on-year comparison of the pilot primary care networks, both with and without a cancer care coordinator in post. So a cancer care coordinator is a support role as well, so they're not a registered member of staff. They do provide that sort of supported level of practice for patients. We saw great results from the patient and workforce satisfaction surveys as well, that the cancer care coordinator really complemented that existing workforce, and they saw it as a benefit, and a really great response from patients as well. We got quite a high number of patient surveys returned to us, and the fact that the cancer care coordinator was listening to what they had to say and then acting on that, I think echoes back to Heather's point there about the communication skills at the right place in the right time with that role. From an impact perspective, we also saw a reduction in patient-initiated GP appointments, and they were 6 months following a cancer care review with the cancer care coordinator. So we've listed 3 localities here. Those are the ones that we had sort of the most robust data from. But what it really shows is that it could provide GPs with the opportunity to utilise those appointments in a bit of a different way, for potentially for more complex patient presentations. So if we go on to the next one, that'd be great. It's brilliant. And we also conducted some quarterly audits as well, just to assess the impact of the cancer care reviews with a cancer care coordinator. And these are some of the most frequently offered sources of support, which I think probably mirrors some of the stuff that David had presented to us earlier. And from a national perspective as well, the National Cancer Patient Experience Survey back in 2021 highlighted that actually 23% of patients reported that they had received a cancer care review. So those increasing numbers are really promising from the cancer care coordinator pilot, but also kind of really emphasise the importance that patients are having these standalone cancer care review appointments as well, and being able to assess those against sort of like frameworks or quarterly audits and stuff could be really good for your practice as well, to be able to signpost patients, but also look after the workforce as well. So if we move on to the next slide. Again, this is just some sort of patient feedback specifically from the cancer care coordinators. So I'll give you a bit of time again to have a look through some of those. I think what really jumps out is the fact that it's compassionate and personalised approach to a cancer care review. That taking it from that sort of data aspect to being a really meaningful conversation and a good patient experience and impactful intervention from a personalised care side. That's brilliant. If we move on. And as mentioned earlier as well, the reduction in the patient-initiated GP appointments. What we wanted to do with this pilot is just to take a bit of a look at a potential financial impact for this as well. So based on the number of appointments saved and according to the King's Fund, the cost of a GP appointment is around about £40 per appointment. So the calculation suggested a potential saving of just over £20,000 per PCN over a 12-month period if they were conducted by cancer care coordinators instead of GPs, in situations where that's felt appropriate. It's of course very much just an indicative picture of potential costs and that cost benefit impact, but it just gives us a bit of a different slant and an idea of potential financial impact when considering things like different ways of working or utilising different workforce roles, and how things could potentially be done a little bit differently when thinking about delivering these interventions for patients. What I will do is pop the full evaluation for this pilot in the chat box as well, just in case you wanted to have a look through that with some of the additional bits that have come out. But if we go to the last slide, Susie, this is kind of just where I think it'd be good to think next, really. So we've recorded this webinar today, and we want to be able to put that out to everyone as a resource. So it could be that if you've heard some particular things today that you might want to revisit or refresh yourself on, utilise this webinar as that recorded resource, but also for newly recruited members of staff as well. It could make a quite good induction feature as well for anybody who's maybe coming into a practice, regardless of role. I really think about who within your practice could conduct those cancer care reviews as well. There's two examples there of workforce roles who work very specifically within cancer, but then we heard from Elizabeth, who's a practice nurse, who's a generalist member of the workforce. So, considering what that might look like, and what you have sort of the time and space for within your PCN as well. And please refer to anything that we've put out as an alliance as well. The personalised care team have done a really good job of pulling everything together within one single web page, which I've posted in the chat already. But of course, please get in touch if there is any further information that you would like from us, or anything that we can do to support in that space. And some of the feedback that we've had, from a more sort of qualitative perspective, it's been really nice as well. Sort of a conversation with a patient that then leads to so much benefit for them, whether it's sort of helping out filling out financial forms, or getting a blue badge, or sorting out who can take the bins out, whatever that looks like. It's been really nice to see some of the qualitative impacts that a cancer care review can have, and again, being that point of contact regardless of whether it's a generalist or a specialist workforce member that's able to do that. So that is the end of the presentations. Really hope that you found it helpful in terms of a webinar. And again, please use that resource as and when you can, and get in touch if you need anything else from us. But what we will do now is move on to the question and answer portion. So we did have an initial question before, which I think has been answered, around about free dental treatment for cancer patients. David's very kindly pops a link in that. So not necessarily free dental treatment for a cancer diagnosis, but patients may be eligible for free dental treatment depending on that eligibility criteria. So there is a link to the Macmillan session in there as well. I've not had any other questions through from the chat, so if anybody wanted to use the hand function to ask any of our speakers any questions, please do feel free to do so. We've got until 2 o'clock, so if anybody wanted to ask any questions, please feel free.
Jess, can I just jump in, because there are several comments on the chat about not being able to find the template. So sure. I have suggested that you can search for the template by using, I think GM Cancer is quite a good way of finding it, because it's a unique title within the template library. If you still can't find it, if you could drop me an email and I will look into it. It should have been distributed across every single practice, so there might be a glitch somewhere, or an update might not have happened in your particular area, so it would be helpful to know where you're from, and I'll try and fix it for you.
Thanks very much, Miranda. So there will be a post-webinar survey that goes out as well, as mentioned at the start, that will it's then a CPD accredited webinar, and that certificate will be sent out post survey completion. And we will be sending the webinar out as a recording, and it will be hosted on the Greater Manchester Cancer Academy website. The personalised care programme do have their own academy, so anything that's related to personalised care interventions, both primary and secondary, there is a lot of information on there as well, which we can pop the link in, and I think it was in Heather's presentation at the start as well. So all those resources are there. There was another point that came up as well about trying to link primary and secondary closer together. So when we send it out, we can make everyone aware of the personalised care leads who exist within the secondary care setting, just in case, you know, within your primary care network, if you wanted to have a bit of a closer link with secondary care, at least you've got the right contact then to be able to facilitate that if needed. But yeah, huge thank you to our speakers today as well. Really enjoyed this webinar, so thank you. Are there any questions before we bring everything to a close? Okay, shall we wrap it up there then? Thank you very much. If you do need anything, of course, get in touch with us here at GM Cancer. But thank you so much for your time today as well. I hope you find it informative, and we'll encourage you to fill out the feedback as well, just so that it helps us improve when we go forward. So thank you very much to everybody for your time today, and enjoy the rest of your day.